Thank you to our sponsor, MBA Growth Partners.
Welcome to Studio 501c3. I'm your host, Kim Jones, CEO of the Nonprofit Village, which incubates and increases capacity for charitable organizations. Our show features nonprofit organizations that provide essential programs and services. They're charities the IRS designates as 501c3 because they provide a public benefit. And in most cases, your donations to the nonprofits are tax deductible. We're also a proud partner of Montgomery Community Media. MCM is your public access resource on the information and programs relevant to Montgomery County. Today, we're talking with Dr. Sonya Bruton, President and CEO of CCI. CCI Health and Wellness is a multi-site community health center that empowers patients with high-quality, affordable health care. Sonya, thanks for joining us today.
Thanks for having me, Kim.
Great. So CCI has been described as this unmatched healthcare experience in the community that serves patients at all stages of life. Tell us how that program has been built and a little bit more about what this community health program actually integrates to be such a renowned program.
Gladly. Thank you for the question. Basically, when you think of CCI Health and Wellness, you think of whole health. And what that means is that we deal with physical health, mental health, and in those systems, we work with all parts of the body so that we have a dental program because oral health impacts your physical health. We wrap around all the services that are necessary to have a really strong and whole healthy body and healthy community so that we add to that at CCI some of the social determinants of health. And we make sure that we focus on various populations. And what that looks like here in the counties that we serve, which are Montgomery County and Prince George's counties, with most of our footprint being in Montgomery County, what that means is when you establish care with us and we are open for anyone who needs services, that's all spectrums of our community and our populations. When you establish care from us, we actually take care of the whole person.
So this is really a lot more than just the routine primary care. People, say, okay, well, I'm just going to have this checkup and that checkup. You're really going beyond that, right?
Absolutely. So we do comprehensive primary care. And what that means is if you have an infectious disease, then we consider that a chronic illness. Chronic illnesses are covered by primary care, but we add into those HIV, hepatitis C. It also means that if you are food insecure, if you're between the ages of 0 and 5, we operate the largest WIC program in the state of Maryland. We will make sure that you have benefits and can get food. If you're beyond those ages.
Yeah, can I interrupt you for just a second?
Absolutely.
So with the food insecurity, does that require you to actually partner with other agencies and organizations? How does that food insecurity get addressed through CCI?
As I said, if you're a child, then we actually give you benefits to go and get groceries at the store, the household for the WIC program. There are some eligibility requirements for that. If you are not in that age group and just have a need, we partner with, by meaning we have an account and we pay for subscriptions to Hungry Harvest for our patients. And those boxes of fruits and vegetables actually arrive at their doorstep. And then we use our nutritionists to give recipes, cooking demonstrations so that people know how to use the produce that comes to them. Because we serve every member of the community, Kim, we have those who are not originally from this country. Sometimes they don't know what those vegetables are. They don't know how to use them.
That's a good point. And then there are people who obviously are born and raised right in the community whose roots go back far, but may not have had extensive exposure to all the types of healthy foods because of, as you said earlier, insecurity or just lack of access in a lot of ways. One of the things that Montgomery County is doing so much in recent years is really moving the farming community, so that there's fresh produce that's available in all communities, and making sure that there are these urban gardens all around the county that give people more access.
Absolutely. And I mentioned that our WIC benefits are used at grocery stores. We can also use them at farmers markets. We have partner farmers markets so that residents can take that benefit and use it in either one of those two locations.
Thank you for sharing all of that. What about the services and how they are paid for? Are people coming in and being charged on a sliding scale? Is it another kind of system that's set up? What happens, especially when someone can't afford the cost of service, which, considering economic downturns and pandemics and things in the past decade, there are a lot of people that are stuck in that situation.
Absolutely. We do offer a sliding scale that we call a full discount program. And what that means is based on your income and how many people live in your household, that bill can go all the way down for a medical visit to $35 and for a dental visit to $50. And in those prices, the full complement of the visit are included. For medical, that means your labs. For dental, it means your x-rays.
Wow. All right. Well, we've only got a minute left before we go to break, and I want to talk a little bit about your personal experience. You have extensive experience in community health programs, as well as obviously the professional credentials, which has helped to make CCI this premier healthcare nonprofit. So I want to talk a little bit about merging the needs of staff, community programs, and everything. So just very quickly in 30 seconds, anything about how you bring all of that together?
Absolutely. I'm a lifelong community health center participant myself. I received my care at places like the one that I operate as a child. And so I know it from all sides, Kim.
Okay. All right. Well, we're going to take a brief break. When we come back, we're going to talk a little bit more about that. And there's a specific program I want to learn more about. So you'll hear more about the healthcare programs provided by CCI Health and Wellness Services. Studio 501c3 on Montgomery Community Media. We'll be right back.
You're there for them. We're here for you. Find free care guides at aarp.org/caregiving.
Hey, Bobo, do trees tell each other stories?
I'm sorry. I'm afraid I don't know that.
Hey, why don't we go find out? Listen.
Here you go.
Thank you.
Thank you.
Welcome back to Studio 501c3, your resource on exceptional nonprofit programs in Montgomery County. I'm talking with Dr. Sonya Bruton, President and CEO of CCI Health and Wellness Services. Sonya, before the break, we were talking about how you have merged all of your personal experience, the nonprofit management experience, in order to fill the needs of people in the community. Is there anything else that you might want to share about how you bring all of that together and make sure that needs are addressed that might pop up that the rest of us might not know about, but you're seeing things on the front line?
Absolutely. So one of the things that I bring that's a little unique to my role is that really having lived in the shoes of every spot in the delivery of services that we have, whether that's the staff shoes, the patient's shoes. I actually was a patient of the organization that I'm now running before I began to work for the organization. So I believe in the value of care at federally qualified health centers and at CCI in particular. One of the things that we have that many folks don't know about is in in all of the areas that we serve in all the communities, each county has a program that allows for assistance in the cost of their care if they're uninsured or if they're underinsured. So the discount that we offer is available whether someone has insurance, but maybe that insurance has a high deductible. We'll discount that cost because that first payment has to come out of your pockets. If you're a Montgomery County resident, there's the Montgomery Cares program, which actually contributes toward the cost of the bill on county residents' behalf.
Is that something that you find we need to do a better job of disseminating information on so that more people are aware? There probably is a lack of awareness about that model.
Absolutely. So we at the health center at CCI Health and Wellness, we make sure people know when they come to establish care, but there are many people who never go in anyone's doors to try to seek care because they feel like they can't afford it. And so absolutely, it's when we try to have information up on our website, we try to put things out in our social media platforms, get the word out as much as we can so that everyone knows that there's no barrier to care in this part of the state.
And in some ways, we always have to look at making sure there's culturally competent information dissemination channels, that the vehicles through which people get their information, whether it's through their house of worship or their social or civic organizations, oftentimes that's where people pick up information and they fail to pick it up on a website because they just don't know. So, but I wanted to ask you about another program, Run Baby Run. Tell me about Run Baby Run.
Run Baby Run is our annual fundraiser. So here at CCI, we carry our focus all the way through to all of our activities and including our annual fundraiser. And so it's a community event. It is a 5K race that happens every August. We combine it with the National Breastfeeding Week in honor of our WIC program that is affectionately known as Breast Fest. So we have our run and our Breast Fest every year. And what we do is open it up for community members to come and participate as us in paying their registration, sponsoring teams. We also get people to sponsor registration so that the cost of participating is not a barrier for getting involved. We bring vendors, we bring information, we have music, we have food, and we get out there and move together. And all proceeds go to benefit our prenatal program, which is mostly made up of people who do not have insurance.
Oh, wow. Well, it sounds like, number one, a fun program, and all of that information is on your website?
It is.
It is? Okay. So we'll make sure to direct people to the site. We're going to be putting up your website as well. And it sounds like a beneficial program for so many people. So we are actually almost out of time here. Last 10 seconds or so. What do you have in store for the future?
We are adding more and more programs. We're building a teaching kitchen at our Silver Spring location. We're doubling the size and making it our innovation center. So we'll be bringing best practices in terms of caring for the conditions that come into our doors. We are the refugee health provider in the state of Maryland for this quadrant of the state. And so we'll be bringing more resources to that population and beginning to expand. So we'd love to see the community and you too out at our Run Baby Run in August and love to provide care to anyone who needs it in the county.
Great. Thank you so much. I'm so sorry we're out of time, but really, I want to thank you for sharing all of this information with our audience, and let's do a better job of sharing it with our friends and neighbors. For more information about CCI, you can visit their website at cciweb.org. I'm Kim Jones. Thanks for joining us, and see you on the next edition of Studio 501c3 on Montgomery Community Media.